DCH is the Georgia state agency responsible for health care planning, financing, and regulation, and provides health care for approximately 2 million people. Dr. Edwards serves as the principal advisor to the Commissioner of Community Health on health care policy. Prior to her current position, Dr. Edwards was the executive director of the South Florida Health Information Initiative, a regional health information organization designed to improve health care quality, access, and efficiency through technology. She also serves the first executive director of the Florida Governor's Health Information Infrastructure Advisory Board. Dr. Edwards earned a BA in sociology and an MS in education from the University of Pennsylvania. She holds a doctorate in medical sociology from the University of Florida. Welcome to the subcommittee, Dr. Edwards. We look forward to your testimony.
Thank you, and good morning, Chairwoman Dal Kemper and Ranking Member Westmoreland. Thank you for the opportunity to invite me to testify on a subject that I'm exceptionally passionate about: health information technology. My name is Carladenise Armbruster Edwards, and as the Chief of Staff for Georgia's Department of Community Health, as the ranking member has said, I'm responsible for the health care for over 2 million Georgians. Our department provides health care through the Medicaid program, the state employee program, and we ensure compliance with health care regulations across the state. On July 1st, we'll also assume responsibility for public health, emergency preparedness, and health care facility regulation. Prior to serving as a Chief of Staff for Georgia's Department of Community Health, I actually founded my own business, the Bay Company. My father and I, Lieutenant Colonel Anthony Armbruster, Marine Corps retired, and I built the business with the intention of helping other small businesses achieve their strategic goals through business development, implementation of technology, change management, and system redesign strategies. So therefore, I come before you not only with some knowledge and experience in health information technology implementation, the impact on state government, but also with some experience in small business ownership. First, I'd like to talk to you a little bit about the impact of health information technology on healthcare providers and the benefits and the drawbacks of the Recovery Act from the perspective of a large government employer who contracts with healthcare providers for the Medicaid and state health benefit plan. As you can imagine, the state of Georgia has a vested interest, a $12 billion interest, in ensuring healthcare services are provided in the most cost-effective and efficient manner possible. We want to make sure our employees have access to quality health care so that we have a strong, productive workforce, and we want to make sure our beneficiaries have access to health care at the lowest possible cost to the state. Therefore, we're strong proponents of health IT. Georgia's Department of Community Health is actively participating in the advancement of health information technology and transparency projects in several ways. First, we've established a health transparency website that provides healthcare consumers with information that allows them to identify providers by location, cost, and quality. It also gives them the opportunity to evaluate health plans. We think it's critically important that consumers actively participate in understanding the opportunities that come from health information technology and managing their own health care. The department has also provided grants to large and small healthcare providers to implement health information technology systems in their practice. However, due to state budget constraints, this program is at risk of being discontinued, despite the fact that we've seen the financial benefit to implementing interoperable health information exchange that can reduce duplication, improve patient safety, and increase access to care through the use of telemedicine and electronic prescribing. Thirdly, Georgia's Medicaid program is in the process of creating a technological solution that would be web-based and allow Medicaid providers a secure access to an electronic health record system in a virtual environment. We're hoping that this will help avoid or eliminate some of the challenges that the previous panelists have spoken about related to the cost of purchasing, hosting, and maintaining a hardware and software solution, and in many cases that is not something that's viable for a small physician in practice. And then lastly, but not finally, just don't have time to tell you about everything we're doing, DCH is working collaboratively with our private and public partners to sustain Georgia's electronic health record partnership. We're trying to position ourselves to serve as one of the regional extension centers that the coordinator spoke of earlier through the HITECH Act. We also look forward to being able to disseminate loans to small physician practices and grants to providers through the HITECH Act, as well as to create the opportunity for training and technical assistance, which is so very much needed in order to ensure compliance with the rules and regulations, as well as the new HIPAA provisions. Georgia is looking forward to the opportunities presented in the HITECH Act, but we're very aware of the potential drawbacks, primarily the drawback being failure. Frederick Douglass once said that power does not concede without demand. The failure will come from consumers' inability to really advocate on their own behalf. And those consumers are consumers of health care, as well as the providers and the small businesses who consume the resources that our healthcare industry provides. So we think it's critically important that we provide the incentives and that we're able to advocate for consumers as well as small businesses at the state and federal level. Thank you for this opportunity.